Placebo effects are more than just mind over matter. They represent a fascinating interaction between our brain's expectations, beliefs, and physiological responses. Studies suggest that placebos, substances or procedures without therapeutic ingredients, can bring about real changes in the body. In fact, up to 35% of people in clinical trials report improvements when given a placebo, and this effect can sometimes be powerful enough to rival actual treatments. But how does this happen? The power of placebo lies mainly in two mechanisms: expectation and conditioning. When someone believes they're receiving a treatment that will help them, their brain may release chemicals like endorphins and dopamine. These neurotransmitters not only help manage pain but can also enhance mood and reduce anxiety. For example, in placebo pain studies, patients who believe they are receiving a painkiller show similar brain activity to those taking real opioids. Remarkably, when these patients are given naloxone, an opioid blocker, the pain relief effect disappears, showing that the body's natural opioid system is at work. Conditioning also plays a role. If someone associates a certain action, like taking a pill or seeing a doctor, with relief, their body can learn to respond as if the real treatment is being given. This effect was first noticed in animal studies, where rats conditioned to expect a painkiller would show pain relief even when they only received a placebo. In humans, these learned associations can help explain why placebo effects often get stronger over time. But it's not just about the pill or procedure. The context of the treatment, the environment, the relationship with the doctor, and even the way information is conveyed can amplify the placebo effect. In one study on irritable bowel syndrome (IBS), 62% of patients who received a placebo in a warm and supportive setting reported significant improvement, compared to only 28% in the no treatment group. This suggests that a compassionate, engaged doctor-patient interaction may activate the brain's healing pathways, fostering a state of comfort and hope that can improve outcomes. In fact, researchers have used the open-hidden paradigm to show how expectations influence treatment effects. In this approach, patients receive medication either openly, with knowledge of what they're receiving, or covertly, without knowing it's being administered. Surprisingly, drugs given in an open context, when the patient is aware and expects relief, often work twice as effectively as those given covertly. This has been demonstrated with painkillers, anxiety treatments, and even Parkinson's therapies. Placebo effects are especially pronounced in treatments with elaborate rituals, like acupuncture. Large trials comparing real and placebo acupuncture using sham needles found similar pain relief in both groups, suggesting that the ritual and the patient's expectations can be enough to trigger the body's natural healing response. Positive expectations doubled the likelihood that patients would report improvement, showing that alternative treatments may often work through these psychological pathways. Understanding that placebos can have real, measurable effects opens up interesting possibilities for healthcare. It suggests that harnessing these psychological effects could help enhance traditional treatments. For instance, if a doctor's encouragement and a supportive atmosphere can boost a patient's response, it may be worth actively cultivating these elements in medical settings. However, using placebos also raises ethical questions. Many placebo studies involve an element of deception. Patients believe they're receiving an active treatment. Can we harness placebo effects without misleading patients? Some recent studies suggest that open-label placebos, where patients know they're taking a placebo, can still be effective. This points toward new, ethical ways of using placebos in practice. Do you think doctors should leverage placebo effects intentionally to enhance patient care? Have you ever experienced an improvement in symptoms after a fake treatment, like a home remedy or a routine doctor visit? Could placebo treatments have a role in regular medical practice, especially if patients know about the psychological effects? Share your thoughts in the comments. Let's discuss the intriguing potential of placebo in healthcare.